Hey, Dr. Sandoval, I've got a problem here that's making me wonder if I'm thinking about it correctly. It says an infant weighs 61 pounds and asks what the required IV flow rate in milliliters per hour is to maintain proper fluid levels. I think I need to figure out the fluid requirements first, but I'm not sure if there's a standard formula I should be using for infants based just on weight.
This is a great problem, Priya, because it requires us to recall some standard pediatric nursing principles that aren't always explicitly given in the problem statement, which is a common real-world scenario. The problem asks us to find the IV flow rate in milliliters per hour for an infant weighing 61 pounds. Before we even get to a fluid formula, what's the first thing we usually need to do with a patient's weight when it's given in pounds for a dose calculation?
Oh, right. We need to convert the infant's weight from pounds to kilograms, don't we? That's always the first step for weight-based calculations. I totally forgot that for a second.
Exactly, Priya. That's a crucial first step for almost any weight-based calculation in nursing. We need to work in kilograms. How many kilograms is 61 pounds?
Okay, so I'd multiply 61 pounds by 2.2 kilograms per pound, right? So 61 times 2.2, I get 134.2 kilograms. Does that sound correct for the infant's weight in kilograms?
You're on the right track with using the conversion factor, but let's check the direction of that multiplication. Remember, we want the pounds unit to cancel out, leaving us with kilograms. If we multiply 61 pounds by 2.2 kilograms per pound, what happens to the units? Let's rethink the setup. We have 61 pounds, and we know 1 kilogram is approximately 2.2 pounds. How should we arrange those to get our answer in kilograms?
Oh, you're right. I want the pounds to cancel out. So I should divide 61 pounds by 2.2 pounds per kilogram instead. Let me try that. 61 divided by 2.2 is 27.727. So around 27.73 kilograms, rounding to 2 decimal places. Is that the correct way to do it?
Yes, that's absolutely the correct way to do it. Dividing 61 pounds by 2.2 pounds per kilogram makes the pounds units cancel out, leaving you with kilograms. So, 27.73 kilograms is the infant's weight. Now that we have the weight in kilograms, what's the next piece of information we need to determine the fluid requirements for an infant?
Okay, so for infant fluid requirements, I think we use the Holiday-Seeger method, right? It's something like 100 milliliters per kilogram for the first 10 kilograms, then 50 milliliters per kilogram for the next 10 kilograms after that. I'm not entirely sure about the amount for weights over 20 kilograms, though. Do we still use 20 milliliters per kilogram for that part?
You're absolutely right, Priya. The Holiday-Seeger method is exactly what we use for calculating daily fluid maintenance in infants and children. You've correctly recalled the first two tiers, 100 milliliters per kilogram for the first 10 kilograms and 50 milliliters per kilogram for the next 10 kilograms. And yes, for any weight above 20 kilograms, it's 20 milliliters per kilogram. Now that you have the full method, how would you calculate the total daily fluid requirement for our 27.73 kilogram infant?
Okay, so for the 27.73 kilogram infant, I'd break it down. First, 10 kilograms at 100 milliliters per kilogram is 1,000 milliliters. Then, the next 10 kilograms at 50 milliliters per kilogram is 500 milliliters. So that's 20 kilograms covered. For the remaining 7.73 kilograms, I'd use 20 milliliters per kilogram, which is 154.6 milliliters. My total would be 1,000 plus 500 plus 154.6, which is 1,654.6 milliliters for the day. Is that how I apply the last part of the Holiday-Seeger rule?
Excellent work, Priya. Your application of the Holiday-Seeger method is perfect. You correctly broke down the infant's weight into the 3 tiers, calculated the fluid for each, and summed them up. 1,000 milliliters plus 500 milliliters plus 154.6 milliliters equals 1,654.6 milliliters for the total daily fluid requirement. Now, the problem asks for the IV flow rate in milliliters per hour. You have the total volume for the day, so what's the next logical step to get to an hourly rate?
Okay, so I have the total daily volume, 1,654.6 milliliters. To get the hourly rate, I need to divide that by the number of hours in a day. So 1,654.6 milliliters divided by 12 hours. That gives me 137.88 milliliters per hour. Does that sound right?
You're definitely on the right track with dividing the total daily volume by the number of hours. That's how we get an hourly rate. However, let's double check the number of hours you're dividing by. How many hours are there in a full day?
Oh, right. A day has 24 hours, not 12. I always mess up those simple time conversions. So it should be 1,654.6 milliliters divided by 24 hours. Let me recalculate that.
It's easy to overlook those simple details, but catching them is part of becoming a precise nurse. Now that you've got the correct number of hours, go ahead and recalculate the IV flow rate for me.
Okay, so 1,654.6 milliliters divided by 24 hours. I get 68.9416. So if I round that to 2 decimal places, it's 68.94 milliliters per hour. That feels more accurate. Is that the correct IV flow rate?
Yes, that's exactly right, Priya. By dividing the total daily fluid requirement of 1,654.6 milliliters by 24 hours, you get 68.94 milliliters per hour. This is the correct IV flow rate to maintain proper fluid levels for this infant. Congratulations, you've solved the problem. To summarize, we first converted the infant's weight from pounds to kilograms, then used the Holiday Seagar method to calculate the total daily fluid requirement, and finally divided by 24 hours to find the hourly IV flow rate.
Oh, thank goodness. It's such a relief to finally get to the right answer. I really needed to work through the conversion and remember all the parts of the Holiday Seagar method. Thanks so much, Dr. Sandoval. I feel much better about this now.